In this video, we will talk about surprising things that can hurt your kidneys. So be careful then. Let's start. Too much protein. Protein is essential to a healthy diet, but if your kidneys don't work normally, eating too much of it can overtax them. Check with your doctor. You may need to eat small portions of different types of protein. Eggs, fish, beans, and nuts are all good sources. Salt. In some people, too much salt can raise blood pressure and speed up kidney damage. It also may lead to kidney stones, which can cause nausea, severe pain, and trouble peeing. Pretzels, chips, and crackers. Ready-to-eat snack foods like pretzels, chips, and crackers tend to be lacking in nutrients and relatively high in salt. Also, it's easy to eat more than the recommended portion size of these foods, often leading to an even greater salt intake than intended. What's more, if chips are made from potatoes, they'll contain a significant amount of potassium as well. Dehydration. Your kidneys need water to work properly. Not getting enough, especially if that happens often, can cause kidney damage. How can you tell if you're drinking what you need? Your pee should be light yellow. Oranges and orange juice. While oranges and orange juice are arguably most well known for their vitamin C content, they're also rich sources of potassium. One large orange, 184 gram, provides 333 mg of potassium. Moreover, there are 458 mg of potassium in 1 cup, 240 ml of orange juice. Given their potassium content, oranges and orange juice likely need to be avoided or limited on a renal diet. Grapes, apples, and cranberries, as well as their respective juices, are all good substitutes for oranges and orange juice, as they have lower potassium content. Pain medication. Taken regularly, large amounts of over-the-counter pain medications acetaminophen, aspirin, naproxen, and ibuprofen, or the prescription NSAID Celebrex, celecoxib, can damage your kidneys, but that doesn't necessarily mean you have to tough it out. Talk to your doctor about what you're taking and how much to see if you might need another option. Packaged, instant, and pre-made meals. Processed foods can be a major component of sodium in the diet. Among these foods, packaged, instant, and pre-made meals are usually the most heavily processed and thus contain the most sodium. Examples include frozen pizza, microwavable meals, and instant noodles. Keeping sodium intake to 2,000 mg per day may be difficult if you're eating highly processed foods regularly. Heavily processed foods not only contain a large amount of sodium, but also commonly lack nutrients. Illegal drugs. The use of cocaine, heroin, or methamphetamine, not a good idea for a host of reasons, can cause kidney damage in different ways. Some of these drugs can lead to high blood pressure, as well, one of the leading causes of kidney disease. Overtraining. Working out too hard for too long can cause rhabdomyolysis, a condition in which damaged muscle tissue breaks down very fast. This dumps substances into your blood that can hurt your kidneys and make them fail. Don't overdo it. Build up your workouts. Gradually, don't suddenly make them more intense. If you can, avoid working out in high heat and humidity. See your doctor if you have muscle pain and dark-colored pee. Bodybuilding steroids. Some people take anabolic steroids drugs that work like the male hormone testosterone to get extreme muscles, but they can cause scarring in the parts of your kidneys that filter your blood. This can make your body parts swell, make you lose protein in your blood, and give you high cholesterol. Heartburn drugs. Drugs called proton pump inhibitors, PIAs, which cut down on stomach acid, can cause kidney damage if you take them for a long time. Some studies suggest that taking a lot of PIS can also make you more likely to get long-term kidney disease. If you're worried, ask your doctor if another kind of heartburn drug, an H2 blocker, might be better for you. Strep throat. When you have this infection, your body makes proteins called antibodies to fight it. Extra ones can settle in the filtering parts of your kidneys and make them inflamed. It usually doesn't last long, but the kidney damage may be permanent for some people. If you think you have strep throat, see your doctor as soon as possible. Smoking. Not only can it worsen high blood pressure and type 2 diabetes, the two leading causes of kidney disease, but it can interfere with medicines used to treat them. It also slows blood flow to the kidneys and can cause kidney problems in people who already have kidney disease. Canned foods. Canned foods such as soups, vegetables, and beans are often purchased because of their low cost and convenience. However, most canned foods contain high amounts of sodium, as salt is added as a preservative to increase its shelf life. Due to the amount of sodium found in canned goods, it's often recommended that people with kidney disease avoid or limit their consumption. Choosing lower sodium varieties, or those labeled no salt added, is typically best. Additionally, draining and rinsing canned foods, such as canned beans and tuna, can significantly decrease the sodium content. Brown rice. Like whole wheat bread, brown rice is a whole grain that has a higher potassium and phosphorus content than its white rice counterpart. Each cup, 155 grams, of cooked brown rice contains 149 mg of phosphorus and 95 mg of potassium, while 1 cup, 186 grams, of cooked white rice contains only 69 mg of phosphorus and 54 mg of potassium. You may be able to fit brown rice into a renal diet, but only if the portion is controlled and balanced with other foods to avoid an excessive daily intake of potassium and phosphorus. Bulgur, buckwheat, pearl barley, and couscous are nutritious, lower phosphorus grains that can make a good substitute for brown rice. Dates, raisins, and prunes. Dates, raisins, and prunes are common dried fruits. When fruits are dried, their nutrients are concentrated. This includes potassium. For example, 1 cup, 174 grams, of prunes provides 1,270 mg of potassium, which is nearly 5 times the amount of potassium found in 1 cup, 165 grams, of plums. Its raw counterpart, moreover, just 4 dates provide 668 mg of potassium. Given the high amount of potassium in these common dried fruits, it's best to go without them while on a renal diet to ensure your potassium levels remain favorable. Swiss chard, spinach, and beet greens. Swiss chard, spinach, and beet greens are leafy green vegetables with high amounts of nutrients and minerals, including potassium. When served raw, the amount of potassium varies between 136–290 mg per cup, 30–38 grams, while leafy vegetables shrink to a smaller serving size when cooked. The potassium content remains unchanged. For example, raw spinach can significantly shrink when cooked. Therefore, eating 1/2 cup of cooked spinach will contain a much higher amount of potassium than 1/2 cup of raw spinach. Raw Swiss chard, spinach, and beet greens are preferable to cooked greens to avoid too much potassium. However, moderate your intake of these foods, as they're also high in oxalates. Among sensitive individuals, oxalates can increase the risk of kidney stones. Kidney stones may further damage renal tissue and decrease kidney function. Alcohol. Heavy chronic drinkers may increase their risk of chronic kidney disease. A single binge session, more than 4 or 5 drinks in less than 2 hours, rarely leads to acute kidney injury, and when it occurs, people usually don't need dialysis. Sodas. If you drink 2 or more diet sodas a day, you may be more likely to get kidney disease. In one study, diet soda drinking women had kidneys that worked 30% less well after 20 years compared with other women. Sugar-sweetened drinks, including juice and soda, are also associated with a higher incidence of kidney disease. Thank you for watching. Subscribe to our channel and hit the bell icon for more informative videos.